And we're back. Thanks for sticking with us. I'm Mabel, Jong. You're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. And in the studio right now, Lee Lewis, Area Vice President and Managing Director, Innovation Lab Practice at Arthur J. Gallagher. Welcome back, Lee.
Yeah, thanks for having me.
It's really great to see you. Now, in your position, you get to talk with startups that are very interested in addressing specific needs in healthcare.
Right.
What sort of interesting situations, companies have you been talking with?
Yeah, honestly, there are so many. Within healthcare, because it's a $3 trillion market, there are so many different areas where you can find a little tiny piece of that and have enough revenue to support a billion-dollar company or a multi-billion-dollar marketplace. And so I have the opportunity to see how 20 years ago, there might have been 5 or 10 verticals that were all operating within healthcare at a high level, and now there might be dozens or hundreds that are all selling into the employer healthcare space. Mm-hmm. Specifically, some of the ones that are most interesting are those that are finding new ways to tackle fertility and infertility. It might be maternity. There's others that are helping coordinate between cancer, and there are others that are finding new clinical interventions for diabetes or back pain, and it's really wonderful.
Yeah, definitely. It seems like you're really on the front lines, able to see what's coming up next.
Yeah.
Yeah.
Entrepreneurs tend to move much more, with a lot more agility, mm-hmm. to find opportunities and to seize upon them and find a better way to service that population. And many of them find that the best way to reach them is through the employer channel rather than trying to bolt into the hospital architecture to try and reach people as sort of they work their way into the hospital. And so I'm fortunate to be able to see a lot of really exciting new therapies and technologies coming to the healthcare space.
And what are the innovations you've seen that are really exciting?
One that is really exciting, a couple. The first that is really interesting to me is that Copenhagen, a center there for diabetes called Stena, recently published in the last year a 14-year study they had with individuals who had type 2 diabetes and started to have failing kidneys. This is a very high-risk population. And they found that if they put these individuals on the traditional insulin therapy or sort of glucose monitoring therapy that we use today versus an alternative therapy that tackled a few other sort of ancillary areas of maybe hypertension or heart, that the alternative therapy reduced deaths by 7/8, reduced blindness and amputation by 2/3, that reduced heart attacks by 3/4. It was just radical reduction in risk and death and disease. And upon seeing this, a lot of doctors have been alerted to this, and it's very, very exciting. And now comes the challenge of how do we re-educate and help that new therapy to get out to millions of people in hundreds of cities. And I'm working with a handful of very innovative employers, payers, and also clinics and clinical advisors to be able to find a way to bring that therapy hopefully to millions of people. Yeah. Today, if left sort of to its own devices, the healthcare system takes 17 years to adopt and fully distribute a new therapy, which means that newly published therapy will be available for everybody by the year 2035, and that's unacceptable. So we're looking to bring that right away.
That's a long time.
That's one example.
Definitely a long time. I mean, are organizations as focused on that, bringing new innovative therapies to the market as they are trying to cut costs?
Yeah, it's a good question. They're one and the same. If a therapy is real, if there is a solution that we would consider a great solution in healthcare, we look for something that would be disruptive, which is generally 90% lower cost and better, more effective than whatever the prevailing therapy is. And so what we're looking for is not $1 million a year drug to help save lives. We're looking for a $500 a year drug or combination of drugs that can achieve the same or much better results. And that's what we're looking for whenever we're out looking for something that's truly innovative, is that It can be curative. It can have massive impact on the quality of care and the health of people. And if we've done that successfully, it will have a commensurate reduction in cost.
What are some of the questions you're coming to this conference with that you're hoping to get some answers to?
Yeah, when I come to a conference like this, I'm looking for new breakthroughs. So there's always something new, some new development that's going to be able to help people. I am looking for new partners, employers or other interested parties who might have impact on a population so that we can start to bring and evangelize these kinds of new solutions to populations to help ultimately save lives and millions of dollars for the plans who are doing that, so that we can reduce the overall cost of care and improve the user experience, which is kind of the third thing that I'm looking for, is always on the lookout for new solutions that can help make a better, more simple, more comprehensible and a better service experience for regular moms and dads and kids to be able to access the healthcare system.
Right. Lee Lewis, thank you so much for your time today.
Yeah, my pleasure.
Really
Thanks for
appreciate
having
it.
me.
I'm Mabel Jong. Thanks to you for sticking with us. We have more to come.